Hello. We're live. So I'm just going to wait a couple minutes to see if I get some people to come on. Hi. We're live. My first live, y'all. Going to be teaching you guys about hyper versus hypovolemia MED-SURG. Don't be afraid. Say hello in the comments. I'm just going to wait until like a full minute. Going to wait a full minute and a half, and then I'm going to start. Hi, welcome. Hello. This is my first live, y'all, so don't let me be on here by myself. Help a sister out. Say hello. Speak back, you know. Hi. All right, so I'm going to start in about 10 seconds. I have the chat up, so feel free to say hello. All right, so let's get into it. All right, so hi, Wanda. So I'm not sure if the ones that are attending now or if you are currently in MED-SURG, but this is going to be based on MED-SURG 1, hypervolemia versus hypovolemia. I got a lot of requests on doing something like this because MED-SURG is kind of a difficult subject to learn. So I'm trying to teach it to you guys in a way that I understand it, and it's best to do a live. So if you guys have any questions, you can ask them, okay? So I got my little whiteboard here. I'm going to try to do it the way that it was taught to me. Let me see if you guys can see. I hope the quality is good. All right, so, let me get my marker. Okay, so first off, and feel free to answer questions or to ask questions. So when we first start off with a patient, you have to figure out if the patient's volume status. So there's 3 different types of volume statuses. Guys, make sure you guys share this live to your friends, whoever need help with MED-SURG. Tag them in this video or share the video so they can come on and, you know, ask questions if they have questions. All right, so there's 3 different types of volume statuses. You have hypervolemia, hypovolemia, and euvolemia. So with hypervolemia, that means your blood fluids are increased, and with hypo, they're decreased. Hypo means low, and then euvolemia is normal. So ultimately, the goal for us to do is to try to get the patient to a normal volume status. Now, with that being said, it is easily, you can easily get a patient from high to low very, very fast. So you have to be very careful when you are administering medications, as far as like diuretics or IV fluids, because the patient can easily switch to either or. So our main goal is just to get the patient to a normal status and not to like either drop them super low or increase them super high, okay? So, okay, so with our school, we didn't go over like the disease process in Adult Health 1 or MED-SURG 1. We only worried about pretty much trying to establish what the patient is, what the volume status is of the patient, and then how you should treat it. So next Monday, by the way, I'm starting these segments. Every Monday, I'm going to do MED-SURG Mondays. So next Monday, I'll be going into how to treat a patient with either hypovolemia or hypovolemia, okay? So, let's see. So I'm gonna make this chart that I learned in school. So for hypovolemia patients, we're gonna call them a wet patient, okay? Because hypervolemia is like fluid overload, okay? And then for hypovolemia, we're gonna call them a dry patient. So that patient can be dehydrated, okay? And it's just good to remember these different terms. So when you see them in your in-class style questions, it'll be easier for you to point out what type of patient is what, and then how you can treat the patient. So if you guys have a piece of paper and a pen or something to write with, this is the perfect time to get that out. So you can write this down and save these in your notes. And then this is going to help you a lot on your exams, because instead of trying to read into like each question, once you point out the simple, like the signs and symptoms for each patient, it's going to help you to, establish which patient is what. All right. So we're going to do wet on this side. You guys can see that? Okay. And we're going to do dry. So this is obviously a decrease. So the patient has an increased volume fluid. And then this one is, decrease. And then this one is the increase. All right. So the main things that are going to be, sorry, I got to get up here because the main things that are going to be affected: heart rate, blood pressure, respirations, lungs. Hopefully I have enough space. Pulses, weight, and then the skin. Okay, these are the bases of them, okay? So we're just gonna do a little line here and go from there. All right, so everybody get that? Okay, so let's start off with your blood pressure. All right, so if your patient is wet, so think about this. So if your blood vessel is getting filled up with fluid, what's going to happen to the pressure? It's going to increase because there's too much fluid. It's just like, imagine like a balloon. So you're putting water into a balloon and then it's just getting bigger and bigger and bigger and bigger. And most of the times, like you're trying to hold on tight because the air is trying to like shoot out. So the pressure is increasing, okay, because there's too much fluid in the blood vessel. So we're going to put some arrows here. So your blood pressure is increasing with a wet patient because there's too much fluid in a blood vessel. So the pressure is increasing. So with that being said, with a dry patient, it's going to decrease because it doesn't have enough fluid in the vessels. So that makes sense. So the pressure is going to decrease. The less fluids, the opposite of the pressure. So we're going to put decrease here. So maybe I should do it like this. All right. So speaking of a patient that has a low blood pressure, let's talk about the heart rate with a dry patient. So, if the blood pressure is low, then the heart rate is typically going to be high. And that's because the heart rate is trying to pump super, super hard and it's pumping faster, trying to compensate for all the blood pressure that is not there, to compensate the blood for the, circulating the whole body. So the heart rate is going to be increased. At any time, if you guys have any questions, then please ask them. Now, the key thing is these two things are the classic sign to a patient that's dehydrated. So if you know that you're on the topic of trying to figure out if the patient is hypo or hyper, if the patient has an increased heart rate and a decreased blood pressure, they are dehydrated. So this is a classic sign of a dry patient. Okay, hopefully you guys can. All right. So the heart rate on this side is not going to be, it's going to be low, but it's not going to be like bradycardia, which is like a decrease like in your heart rate, but it's not going to be like a problem, if that makes sense. So typically the heart rate ranges from like 50 to 90. So it'd probably be like closer to the 50 size, so it's not going to be like 30 as a heart rate. It's just going to be, low. So it's not going to be super duper low, but of course it doesn't have to compensate a lot. So it's not going to be pumping super duper hard, but since the blood vessels are so full, it still needs to pump. It's just not going to just stop pumping, you know. It's not going to be super duper low. So we're just going to put, so let's put like 3 and then 2 for here, okay? All right, so what's next on the list? Let's talk about lungs. Does everybody understand this so far? Does it make sense? If it doesn't make sense, please ask me questions and I can try to better expound on it. All right, so let's talk about your lungs. So I'm gonna draw a little picture. So I don't have that much space, but let's draw a fake lung. Y'all don't talk about me. So that's my lung right there. And then these are the alveoli. We know that alveoli is where the oxygen is being exchanged, okay? So if your blood vessels are getting filled up with fluid, like this is a blood vessel, and then it's just getting bigger and bigger and bigger and bigger and bigger, bigger and bigger and bigger and bigger and bigger, eventually the fluid is going to be backed up into your lungs because it's not excreting properly, okay? So if you have fluids in your lung, you're going to hear crackles. And then this essentially messes up your respirations, okay? So this is all fluids in your lung. Guess what it's affecting now? Your alveoli. So guess what? It's not going to be able to exchange the oxygen properly. Let me erase this. So if you're not exchanging oxygen, then what's going to happen to your respiratory rate? It's going to increase because it's trying to get that oxygen flowing, but it can't because your alveoli is impaired, which, you know, essentially causes tissue, impaired tissue perfusion too, because it's not, I'm going to erase this and rewrite it. All right. All right, so this says crackles for you guys. Hold on. I'm not typically doing this, so I'm trying to get the hang of this board. Let me just write it like this first. All right. So your heart rate is going to be increased. Due to the lungs, due to the fluid being backed up into the lungs, which impairs the alveoli, because we know alveoli exchanges oxygen. Does that make sense? I hope this stuff is making sense, guys. Don't, you know, like I said, feel free to comment if you have any questions or anything, okay? All right, so even though this is not on here, even though I didn't write it on here, just a pointer that if your oxygen levels are, if your alveoli is going to be impaired, then your oxygen levels are obviously going to be lower because like I said, the oxygen is not being exchanged properly. So this is just something, if they want to throw that out on there on one of those questions, you'll know. You're going to have a decreased oxygen level. So you do want to put your patient on oxygen. All right, so let's go into the lungs for the dehydrated person. So if there's not any fluid in the lungs, you're not going to hear anything. So the lungs are actually going to be clear. So when you oxygenate the lung for the dehydration patient, they're going to be clear because you're not going to hear anything because there's nothing in there to hear. Okay. Okay, so this is going to be increased. Okay, this is when the heart rate, this is when the respiratory rate is secondary to the heart rate because of the lack of compensation in the for the blood. It's fine. Thank you. So the respiratory rate is going to be increased as well. These are always going to be the same. for respiration. Let me put it on this side. Okay, so the respiratory rate is going to be increased because the heart rate is pumping fast, trying to compensate the blood that has been lost, the blood fluid that's been lost in the body. All right, so let's move on to pulses. So when we're talking about pulses, we're not talking about the rate because we just went over the rate. We're going to be talking about the quality of the pulses. So let me see a way I can explain this. So for a patient that has fluids, like fluid overload, if you palpate the pulses on the patient with fluid overload, it's going to feel bounding. So it's going to be like boom, boom, like you're going to actually feel it, okay? because because of the pressure in the of the blood vessels, because the pressure is high, so it's kind of like it's a reaction to it. I can't think of any other way to really explain that, but just know if your patient has bounding pulses, that means your patient has fluid overload. Okay. So for your dry patients, they're gonna have thready. That's the word that's a term that they use a lot for like NCLEX style questions. They use thready a lot, and that's just like so say like you palpate the pulse, and then it's a pulse, but it's there, and then sometimes it's not there, so it's kind of thready, if that makes sense. Like if it can leave on like palpations, then it's 30. Okay. All right. What do we have left? We only have a couple more left. Well, let's go ahead and do the weight and the skin. So for the weight is obvious. So you got more fluid in your body, you're going to have more weight. So your weight is going to be increased. Your weight is going to be decreased if you don't have that much fluid in your body, if it's not there. So with this, you want to make sure that you're weighing the patient every single day at the same time on the same scale, okay? With the same amount of clothes on, whatever you weigh your patients in, it has to be the same time, same thing every single day that you do it, because if this is off, when the doctor or the physician orders a diuretic or any type of medication to help this patient, it can affect them negatively, and you don't want them to either overdose or underdose them. So you want to make sure that the weight is going to be properly weighed every single day. Okay, it's kind of better to weigh your patients in the morning times. Okay, so for the skin, so edema, the patient is going to have edema, so they're going to be swollen, and I see this a lot in the hospital. Patients have like pitting edema for the most part, like if it's really, really bad, especially patients with like cardiac problems. So pitting edema is like if you put your fingers down on a patient and then you can still see your fingerprint there on the patient, then it's pitting edema. Then of course they have different types of pitting edema, like if it's 1+, 2+, all the way to 4. It just depends on how long your print is still there once you release your hand from that person's leg or whatever you try to palpate at that time. Okay. Ooh. So for the skin here, for a dry patient, so all the mucous membranes are going to be dry. Okay, so we're just going to put dry mucous membranes. I'm struggling with this word, y'all. B, dry mucous membranes. That's kind of self-explanatory. You know, you're going to be a little crusty. All this is going to be dry. I know a lot of times, I don't know if you guys heard, like if your tongue is like super duper white, that means like you need to drink some water. So one more is that specific gravity, because that's going to definitely be on your exams. You guys have got this before I erase it. I mean, it's on the video. You also can go back and watch it, but I don't know if you guys are writing it down. So let's do specific gravity. So specific gravity measures like your urine, okay? The concentration of your urine. So that lets you know if you're dehydrated or not. Yeah, 3, 0. So this is the range. You're going to be here in the morning times, higher, and then you're going to be here after you start drinking water. So more concentrated, less like diluted. Okay? More concentrated, diluted. Okay? Concentrated because you're dry, so you don't have any fluids, and then diluted because you have a lot of fluids. Okay? So that's pretty much it. Do you guys have any questions? These are all the signs and symptoms for hypervolemia versus hypovolemia. Like I said, next week we're gonna do treatments. So we're gonna be talking about fluids and medications as far as diuretics and their side effects. Any questions? I hope I explained everything to you guys, that way you can understand it. I want to start doing lives a lot because I just feel like it's better to interact with you guys I feel like you understand better if I'm like here, because if you ask more questions then I can explain it better. I can explain to the best of my ability. I'm not an expert. I'm only teaching you guys what I've learned. I graduate in a few months, so I just want to give back and just teach you guys all the stuff that I know, and teach you guys the stuff that helped me pass. So if there's not any questions, thank you guys that came on. Wanda, sweet caramel smile, caramel. Did y'all say caramel or caramel? I say caramel. Caramel smile. Thank you guys for tuning in. I will be posting this live. If you got questions or suggestions on videos that you want me to do, that you want me to teach or whatever, then let me know if this video helped you or not. Okay? So bye.